According to data from the American Heart Association, African Americans continue to experience higher death rates from heart disease and stroke than other groups. The first step in changing that is fully understanding how African Americans are disproportionately affected so changes can be made to improve heart health. Here to help us is Dr. Maya Safarova, a cardiologist and clinical professor in the Division of Cardiovascular Medicine at the Medical College of Wisconsin. Thank you so much for being with us.
Hi, Denise. Thank you very much for having me, and I look forward to this conversation.
When we talk about heart health, people just generally tend to think right away, oh, that means you're going to have a heart attack or you've had a heart attack. But there are lots of conditions that can impact our heart health outside of a heart attack.
That is absolutely correct. And that's what we call nowadays prevention is a new intervention. The American Heart Association has so-called Life's 8 Essential, which identifies not just the fact that someone suffered from heart attack, unfortunately, or stroke, or maybe had a stent or bypass surgery, but they have certain risk factors, such as elevated blood pressure or hypertension, or elevated cholesterol or hyperlipidemia. Or there's glucose metabolism abnormalities that could be diabetes, or it could be pre-diabetes. And then there's certain risk factors that are genetically modified or non-genetically modified. For instance, something that we can have direct impact on is diet, physical activity, smoking, sleep, stress. So those are life's 8th essential that altogether, depending on how we approach them, if it is an ideal cardiovascular health or there is an issue, we can either reduce the risk or we can increase the risk.
And when we talk particularly about African Americans tend to have higher risk factors than other groups do. And I'd like to really kind of talk about some of those a little bit. I was just surprised when I was looking at some of the information from the Heart Association, the high percentage of African American adults who have hypertension.
Yes. And that's so important to recognize because I think it all starts with awareness, detection, and then control. So hypertension is one of the leading risk factors that we identify resulting into heart attacks and strokes. And indeed, the prevalence is quite elevated in African American population. And it gets frequently unnoticed, underdiagnosed, or diagnosed later in life, when in fact it occurs earlier in life compared to whites and compared to non-Hispanics. And the earlier we see hypertension, the earlier we identify that in African American population, Black population, there's higher prevalence of certain types of cholesterol. For instance, there is an genetically inherited type of cholesterol called lipoprotein(a). And this Lp(a) is elevated in African Americans. Lp(a) we know is associated with high risk of heart attacks and strokes. And that's important that we would be working towards detecting, early identifying, and as a result, depending on the risk, either optimizing the non-pharmacological approaches or when need be, initiate the treatment. Knowing your numbers makes a difference, and then knowing where you need to get yourself makes a difference as well.
And sometimes people may know those numbers, but they don't necessarily understand them. How important is it to have that kind of conversation with your physician if you've been told what your cholesterol numbers are, or your hypertension, your blood pressure numbers are, but you don't understand what that means?
Absolutely. And the American Heart Association for quite a long time, for decades, has been building those educational resources for the community members, for healthcare providers, trying to present the importance of knowing those numbers. What are the implications? Because frequently, just knowing the number, even if you know that, oh, I have hypertension, and someone told me that's associated with a heart attack, but knowing how it is associated with a heart attack, through which mechanisms, sometimes makes a difference because it motivates the person to then take a next step. And next step would be, what can I do to mitigate that risk? So it all starts either at home or in the physician's office when you use that blood pressure machine and cuff and check your numbers, and knowing that one of the confusing things and exciting things in medicine is that it's evolving. And something that was 10 years ago or 20 years ago considered as normal today, based on current evidence, might be not normal. Here's an example. We used to define hypertension as blood pressure elevated above 140 over 90 millimeters mercury, in certain populations above 150. But now we say that, no, we know that this is already elevated. So above 130 over 80 millimeters mercury is considered to be a risk factor, and that needs to be something that we have to target, sometimes target even to lower numbers.
And the good thing about what you're telling us is that once you know these numbers, you understand the risk, whether it's high blood pressure or cholesterol, you can do something about it.
Yes, that's exactly right. We can do a lot, even if some of the parameters that we're discussing are genetically determined. And there's some wonderful science behind it, looking into what if you have genetically predisposed high risk of blockages in the vessels of your heart, of coronary artery disease. And it turns out if you start implementing and committing to lifestyle changes, you can reduce your risk. And that risk could be equivalent to someone who does not have that genetically elevated risk. So I always, when I see someone in clinic, I always highlight that even if you have something that's genetically determined, and in the African-American population, hypertension is one of those traits that is genetically determined. And that's one of the reasons that we see higher prevalence. In addition to environmental factors, genetics plays a significant role. But that does not mean that we cannot make a difference, and we can start make that difference today. It is sometimes challenging on different layers, different levels, because it is about our habits. It's about how we can change what we eat, how we can change when we eat, how much salt we consume, what do we use for our snacks, how much time do we use being physically active using cardio or resistance training, how much time we work towards our mindfulness, towards trying to mitigate the stress. And it's true that it's easier said than done, because frequently eating healthy is challenging. And we try to work with our Clinical Translational Institute to have what we call science cafes. We reach out to African American churches, we meet, we talk about how to navigate the dietary modifications, how to work towards cardiovascular prevention and optimization. And frequently the feedback that we get is how challenging it is, especially for younger individuals, for our youth, to make those changes, because that does entail it has financial implications. So I think working at a level where community is supported, but also federal and state impact is substantial. How that is regulated when it comes to what we consume is incredibly important.
Well, the good news is that once we understand the information, once we understand what some of our test results and numbers are, the better we can understand that we can have some control over our health and keep our hearts healthier.
That is correct. That is correct. We can make a difference in our longevity, and not only longevity, but also the years lived without having debilitating conditions.
Doctor, thank you so much for sharing this important information with us. We really appreciate it.
Thank you for having me.
And if you want more information on heart disease, stroke, and hypertension, please visit the American Heart Association's website at heart.org. Thanks for joining us this week. We are back again next week. Be well and take care.